Lassa fever remains a deadly challenge in West Africa. Experts say one of the biggest risks comes from how food is handled and stored at home. Rodents infected with the virus are often attracted to exposed food. Once they touch it, they can leave urine or feces carrying the disease. If the food is eaten without proper cooking, infection can follow. Director of Public Health at Edo State in Nigeria, Dr. Stevenson Babatunde says this is a risk factor. Dr. Babatunde's warning focuses on gari, a staple food in many West African countries. It is often dried in the open where rodents can easily contaminate it.
Gari is one of the major food in Nigeria and in West Africa, and majority of persons consume this. And the preparation manner of this gari has predisposed many persons into being infected by Lassa fever virus. For cheap gains, we've discovered that majority of persons, instead of frying their gari completely on fire, they fry them halfway and completely drying under the sun ray. And we know that the Mesomin etnescens, a rodent, is a major transmitter of this virus. Following that, we've discovered that exposing this gari on the floor at this point may predispose the gari being contaminated by the rodent excretors and urine. So we are encouraging that individuals should desist from drying gari on the floor, and rather they should focus on making sure that their gari are fried completely on the fire.
He cautioned that the same risk applies to all foods left on the ground or in open spaces before eating.
Other food that are well cooked, we know from studies that the virus can be killed by heat. So if like the gari, if you make gari with eba, it's safe for consumption. But soaking the gari with cold water, like we call it cassava flake, if you just soak it with cold water, then you are predisposed from contracting the virus. Or eating raw and soaking are of the same category.
In Liberia's Grand Bassa County, more than 60% of Lassa fever cases are among women. Researchers say many of them prepare rodents brought home as food, exposing themselves to infection. Ivan Kuka works with the National Public Health Institute in Liberia.
In Liberia, where I come from, 60 to 65% of the cases of Lassa fever were seen among females. This is because the females are the ones who prepare the rodents in the homes. And so in order for us to address this risk, it is very much important that we identify interventions to reduce risky behavior while preparing rodents. For example, one of the things that we recommended to reduce the rodent population is to ensure the conduct of environmental cleanup. By cleaning our environment regularly, we attack the breeding sites of the rodents and we also reduce their population. So once their population is reduced, it's also going to affect the number of cases that will be seen across a different country.
Liberia has 3 counties with confirmed cases. The disease is now spreading to areas once free from it. At the Abidjan conference, experts stressed that communities must improve sanitation, handle food with care, and protect vulnerable groups. They also highlighted the need for emotional support for victims and caregivers. Here is Dr. Ikete Tubing, consultant public health physician and head of department at the Department of Reform Coordination and Service Improvement at the Iro Specialist Teaching Hospital in Nigeria.
So in our study, we found that about 14% of our respondents, 195 respondents, had clinically significant anxiety, and less than 5% had clinically significant depression. Now this is important because though we know there are many stressors, many things that can create anxiety and depression in the environment we are in today, in the society we are in today, but these are family caregivers who are staying with Lassa fever patients. They're not entering the wards, but they're providing that emotional support when they speak to their patients, speak to their relatives who are outside the isolation ward, or when they are stable and they can come out to the patient care area and talk to their patients. That emotional support is very important. It aids recovery in these Lassa fever patients. So it's important that we also care about their mental state. It's important that we also care about their psychological state. Let's not forget that these are people who face stigmatization in the society, with all the misconceptions about the Lassa fever isolation treatment center, where the community believes, the society believes that when you get to a treatment center, you're not going to come back. These are myths and misconceptions that are bound in our society, but they are not true.
A report by Mohammed Nurudeen.